Good afternoon. This is All India Radio. I'm Saira Mujtaba and with me is Anita Anand with the Midday News. The headlines. India registering declining trends in the number of active COVID cases. Recovery rate improves to 83.04%. Over 17 crore 52 lakh doses of COVID vaccine administered in the country so far. Country registers over 3 lakh 48,000 new COVID cases in the last 24 hours. Government ramps up availability of amphotericin B to fight post-COVID complications of mucormycosis. Ministry of Power takes measures to ensure uninterrupted power supply to 73 major identified oxygen plants across the country. Tamil Nadu announces compensation of 25 lakh rupees each to 45 families of doctors who lost their lives in frontline duty during the pandemic. Assam issues new COVID-19 SOPs for urban and peri-urban areas. Bihar allocates 1,000 crore rupees for free vaccination of 18 to 44 age group. State to recruit 2,580 doctors in rural areas to contain pandemic. Bangladesh conducts first test run for metro train in Dhaka. On International Nurses Day, Prime Minister Narendra Modi expresses gratitude to the hard-working nursing staff who is at the forefront of fighting COVID-19. As the number of COVID cases are on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. Vaccination for persons aged between 18 and 44 has begun at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. And now the news in detail. Amid the second wave of COVID-19 pandemic, India is registering declining trends in the number of active COVID cases. However, several states and union territories are still registering a high number of cases. The Health and Family Welfare Ministry today said that the active cases comprise 15.86% of the cumulative positive cases. It said there are over 37 lakh active cases in the country at present. As the country is registering over 3 lakh recoveries daily from the past many days, the recovery rate has further improved to 83.04%. The Health Ministry has said over 3,55,000 patients have recovered from this infectious disease in the last 24 hours. So far, over 1 crore 93 lakh patients have already recovered from this disease. The country has registered over 3,48,000 new COVID cases in the last 24 hours. The Health Ministry has said a total of 4,205 deaths were reported in the country within 24 hours, taking the toll to over 2,54,000 across the country. This is the highest number of deaths in a single day since the outbreak of COVID-19 pandemic in the country. Meanwhile, the Indian Council of Medical Research has informed that over 19,83,000 COVID tests were conducted within 24 hours in the country. So far, over 30 crore 75 lakh tests have been conducted. India has administered over 17 crore 52 lakh COVID vaccine doses to the beneficiaries so far. The Health and Family Welfare Ministry has said that over 24 lakh 46,000 vaccine doses were administered to the beneficiaries within 24 hours. As the third phase of the vaccination drive is gaining momentum in the country, people are coming forward for vaccination.
The government has taken steps to ramp up availability of amphotericin B to fight mucormycosis. A sudden increase in demand has been observed in some states for amphotericin B, which is being actively prescribed by the physicians to patients suffering from mucormycosis, which is a post-COVID complication. Centre is therefore engaging with the manufacturers to ramp up production of the drug. The supply position is expected to improve with extra imports of this drug and increase in its production domestically. Department of Pharma had on 11th of May allocated this drug amongst the states and union territories based on expected supply that will be available from 10 to 31st of May. The states have been requested to put in place a mechanism for equitable distribution of supplies amongst government and private hospitals and healthcare agencies. The Ministry of Power has taken a number of proactive, preventive and remedial measures to ensure that there is uninterrupted power supply to oxygen plants by the state utilities in view of the COVID pandemic. The ministry is monitoring the power supply to 73 major identified oxygen plants across the country. Out of these, 13 oxygen plants supply oxygen to the NCR region. The proactive measures which have been put in place include daily review by Secretary, power and round-the-clock operation of control room. The position of power supply to all such plants is reviewed every day at the level of Secretary, Power along with the concerned energy secretaries of the states on a case-by-case basis. All issues related to 24/7 power supply to oxygen plants are discussed threadbare during the daily reviews, and interventions are planned and executed in a time-bound manner.
The Health Ministry has clarified that WHO has not associated the term Indian variant with the B1617 variant of the coronavirus in its 32-page document. It said the word Indian has in fact not been used in its report on the matter. Several media reports have covered the news of WHO classifying B1617 as a variant of global concern. Some of these reports have termed the variant as an Indian variant. The Health Ministry termed these media reports as baseless and unfounded. The stress counsellors of ITBP are helping in managing stress among patients at the 500 oxygen-bedded Sardar Patel COVID Care Centre at Radhaswamy Beas in New Delhi. More than 30 stress counsellors have been deployed at the centre by the ITBP. These stress counsellors are deployed under the direct supervision of a senior chief medical officer, psychiatrist, Dr. Prashant Mishra of the ITBP in different shifts 24/7. They offer yoga and meditation exercises to the patients. They are trained at the National Institute of Mental Health and Neurosciences, NIMHANS, Bengaluru. The ITBP is the only force that recruits stress counsellors in its ranks to manage stress among the personnel. Cabinet Secretary Rajiv Gauba chaired the 33rd meeting with the states and union territories to review the COVID-19 situation in the country. Mr. Gauba briefed the states on the action taken by the Government of India in controlling the effect of the COVID pandemic since last year. He informed that the Prime Minister's active engagement with domestic industries for production and supply of liquid medical oxygen, LMO, since September last year has helped in resolving various logistical issues of transport of LMO on land, air and water. The Cabinet Secretary emphasized the need of keeping the public informed about the action taken by the central and state governments. He assured that no stone would be left unturned to provide timely oxygen supply and other medical resources to the hospitals. Mr. Gauba insisted that those eligible for the second dose of vaccination should be given priority and vaccination wastage should be minimized. Expressing his concern over the misinformation on the subject of vaccination, he mentioned that all vaccines that are procured either by the central or the state governments are actually meant for the public in the states, and there is no consumption at the central level.
In Maharashtra, the Brihan Mumbai Municipal Corporation has issued guidelines for starting COVID-19 vaccination in housing societies along with offices. A report from our Mumbai correspondent.
BMC has clarified that the vaccination at housing societies and workplaces can be carried out by registered private COVID vaccination centers. Eligible employees, family members, society residents, maids, drivers, etc. can be inoculated at these places, but for that, beneficiaries have to register on CoWIN portal and they have to produce government-approved photo ID for verification. Societies or workplaces interested to carry out such vaccination drives will have to ensure availability of separate rooms for waiting, vaccination and observation. Basic life support ambulance should also kept ready in case if beneficiary reported adverse event following immunization. Jeevan Bhavsar, AIR News, Mumbai.
INS Tarkash arrived in Mumbai today carrying 2 cryogenic tankers with 20 metric tons medical oxygen each. External Affairs Ministry spokesperson Arindam Bagchi said India deeply values this continuing support from France. He also expressed gratefulness to Qatar for the prompt facilitation in collaboration with the French Embassy in Qatar.
In Karnataka, the State Health Department has come forward to list out vaccination centres where the physically challenged could be vaccinated. The move follows an order by the Karnataka High Court. Such centres will provide vaccination immediately without making the differently abled persons to wait in a queue. These centers will have wheelchairs, differently abled-friendly toilets and ramps. The beneficiaries of such centers are requested to register and fix a date and time of vaccination. Rotary, Lions, Red Cross and many other NGOs have come forward to provide transport to the physically challenged persons registered for vaccination. The Health Department notice says that initially those above the age of 45 years will be vaccinated, followed by those persons who are differently abled and are between the age of 18 and 44 years. Madhya Pradesh Chief Minister Shivraj Singh Chauhan has said that COVID test is every citizen's right and whoever wants to get the test done will be tested free of cost. He was conducting a COVID control review meeting. The state reported 9,754 fresh COVID cases and 94 fatalities yesterday, taking the tally of infections to 6,91,232 and the death toll to 6,595. More details from our Bhopal correspondent.
The number of active cases in the state stands at 1,11,366. Weekly positivity rate in the state is 17.2%. The state ranked 15th in the country in terms of infection. A total of 9,517 patients were recovered from infection yesterday, while 10 districts reported more than 200 new cases. Meanwhile, Chief Minister Mr. Chauhan said that few cases of black fungus have surfaced. An advisory issued by the Government of India has been sent to all hospitals and treatment is being done as per prescribed protocol. Pooja Pivardhan, AIR News, Bhopal.
In West Bengal, the number of daily COVID cases crossed the 20,000 mark for the first time. There were 132 fatalities. The total number of active COVID cases are over 1,27,000, while the daily positivity rate stands at nearly 30%. Kolkata and North 24 Parganas reported 7,971 new COVID cases with 76 deaths. Nearly 50,000 active COVID cases were reported from the two districts, which is around 40% of the total active cases in the state. Kolkata and North 24 Parganas entered the list of districts across the country with highest test positivity rate. The weekly positivity rate recorded from 4th of May to 10th was 44.4 in Kolkata and 46.7 in North 24 Parganas. Though strict restrictions are in place, the state government is not in favour of imposing a complete lockdown and has asked the people to remain indoors. In Odisha, the police continues to ensure safe passage of the transportation of medical oxygen to different parts of the country battling COVID-19. Till date, the state has dispatched more than 10,000 tons of oxygen in over 550 tankers to 11 states, including the national capital, New Delhi. The state government has opened a special cell under Mr. Y.K. Jetwa, ADG, Law and Order, Odisha Police, to oversee the oxygen supply chain. More from our correspondent.
Medical oxygen being produced by industries like the Rourkela Steel Plant and Jindal Steel and Power in Odisha are regularly being transported across to more than 10 states over the last 20 days. Oxygen-loaded tankers are regularly being escorted by the Odisha police through dedicated corridors across the states facing oxygen scarcity. Oxygen being produced in as many as 4 districts of the state like Sundargarh, Angul, Dhenkanal and Jajpur are being loaded off for COVID-19 patients elsewhere. While the state has already dispatched a high of more than 3,385 tons to Andhra Pradesh, it has also sent oxygen to other states like Tamil Nadu, Telangana, Chhattisgarh, Uttar Pradesh, Madhya Pradesh, Bihar and New Delhi. Meanwhile, the state itself is battling a surge in COVID-19 infection at present that has been hovering around 10,000 plus cases for the last few days. Girish Chandra Das, AIR News, Bhubaneswar.
In Telangana, a 10-day lockdown came into force this morning. The lockdown will be relaxed daily from 6 a.m. to 10 a.m. for all activities. Our correspondent says that all outdoor activities have almost stopped.
The usually busy roads of Hyderabad wore a deserted look. With the lockdown coming into force, the police has set up checkposts at several places in the city and continuously monitoring people not to venture out without valid reason. However, government offices are functioning with minimum staff while banking activities are continuing as usual. Except medical shops and petrol pumps, all other business entities have been closed by 10 a.m. Cinema theatres, gyms and sports stadia remain closed during lockdown. As public transport buses are plying before close down, last-minute rush of intra-state travellers seen at the bus stations in Hyderabad. Lakshmi, AIR News, Hyderabad.
The Bihar government has allocated 1,000 crore rupees for free vaccination of people in the age group of 18 to 44 years. The decision was taken at a cabinet meeting chaired by Chief Minister Nitish Kumar. The state government has also decided to recruit 2,580 doctors in rural areas in view of the prevailing COVID situation. Meanwhile, 10,920 fresh COVID cases were reported in the state in the last 24 hours and 13,852 people recovered yesterday. The state also reported 72 COVID fatalities. The state's recovery rate has risen to about 83%, while the test positivity rate has declined to 9.92%.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. India registering declining trends in the number of active COVID cases. Recovery rate improved to 83.04%. Over 17 crore 52 lakh doses of COVID vaccine administered in the country so far. Country registers over 3,48,000 new COVID cases in last 24 hours. Government ramps up availability of amphotericin B to fight post-COVID complication of mucormycosis. Ministry of Power takes measures to ensure uninterrupted power supply to 73 major identified oxygen plants across the country. Tamil Nadu announces compensation of 25 lakh rupees each to 45 families of doctors who lost their lives in frontline duty during the pandemic. Assam issues new COVID-19 SOPs for urban and peri-urban areas. Bihar allocates 1,000 crore rupees for free vaccination of 18 to 24 age group. State to recruit 2,580 doctors in rural areas to contain pandemic. Bangladesh conducts first test run for metro train in Dhaka. On International Nurses Day, Prime Minister Narendra Modi expresses gratitude to the hard-working nursing staff who is at the forefront in fight against COVID-19. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back. You're listening to the Midday News. Tamil Nadu Chief Minister M.K. Stalin has announced a compensation amount of 25 lakh rupees each to 45 families of doctors who lost their lives while in the frontline duty during COVID-19 pandemic. In a statement released at Chennai today, he said that the medical staff who are on duty will be duly rewarded as they have been tirelessly working 24/7 fighting for the lives of patients during the COVID-19 pandemic. According to the announcement, medical staff on duty during the months of April, May and June will be given bonus. More details from our correspondent.
In another move, the Chennai Corporation has decided to employ trainee doctors on a temporary basis for a period of 3 months. In a press release, the Chennai City Urban Health Mission has called for 300 temporary trainee doctors who are in the final year MBBS with a monthly consolidated pay of 40,000 rupees. The doctors have been asked to apply within 2 p.m. tomorrow. There will be a tele-interview, following which their scheduled duty will begin on the 14th of this month. The doctors need to have studied in a government-recognized medical college. A clothing company has also donated 75 lakh worth rupees, PPE suits and face masks to the Chennai Corporation. Joy, AIR News, Chennai.
The Assam government has issued new SOPs for urban and peri-urban areas within 5 kilometers from the periphery of municipal corporation, municipal boards and revenue boards with effect from tomorrow. The government has ordered that all shops and business establishments should be shut down at 1 p.m. daily due to the COVID situation. All educational institutions, government and non-government offices are to remain closed for 15 days. However, online classes are to be continued for students. Religious places are also to remain closed for 15 days. Public transport will be operated with only 30% seating capacity.
Gujarat has recorded 10,990 new cases of COVID-19 yesterday. According to the State Health Department, 15,198 patients recovered during the last 24 hours and were discharged from the hospitals. More from our Ahmedabad correspondent.
More than 5,63,000 patients have been recovered from COVID-19 in Gujarat till now. Now the recovery rate has crossed 80% mark following more patients recovered against the new cases. Maximum 3,059 new cases reported from Ahmedabad, while Surat recorded 790 new cases. 118 patients lost their lives yesterday. With this, the death toll due to COVID-19 in the state has reached up to 8,629. Gujarat has now 1,31,832 active cases at present, out of which 798 patients are on ventilator. Meanwhile, nearly 37 lakh persons have taken the second dose of vaccine till now. Yogesh Pandya, Air News, Ahmedabad.
Today is International Nurses Day. The day is observed every year on the 12th of May to honor nurses. It also marks the birth anniversary of Florence Nightingale, the founder of modern nursing. The theme for this year is Nurses, a voice to lead, a vision for future healthcare. Vice President M. Venkaiah Naidu has complimented the nurses for rendering untiring, selfless service to the people. He said our nurses have been at the forefront during the pandemic, being a critical link in our health infrastructure. Mr. Naidu called upon people to express gratitude to them for their invaluable contribution in advancing the health and well-being of the people. Prime Minister Narendra Modi said International Nurses Day is a day to express gratitude to the hard-working nursing staff who is at the forefront in fighting COVID-19. He said their sense of duty, compassion and commitment towards a healthy India is exemplary. Health Minister Dr. Harshvardhan also thanked nurses on International Nurses Day for going the extra mile in their efforts to nurse the world to health during COVID-19. In a tweet, the minister said their commitment to provide efficient and effective care founded on professionalism, skills and deep compassion is awe-inspiring. Information and Broadcasting Minister Prakash Javadekar has expressed deep gratitude and kudos to the spirit of all the nurses who are the primary caretakers, especially during these COVID-19 times. In a tweet on International Nurses Day, Mr. Javadekar said they are the ones who care and nurse people to recovery, sometimes like a mother, at times like an elder sister.
Prime Minister Narendra Modi has expressed grief on the demise of noted Assamese literator and journalist Homen Borgohain. In a tweet, Mr. Modi said, Homen Borgohain will be remembered for his rich contributions to Assamese literature and journalism. The Prime Minister said his works reflected diverse aspects of Assamese life and culture. He expressed condolences to the family and admirers of Homen Borgohain. Former Urdu newsreader of All India Radio, Afsar Ali Jafri, passed away in New Delhi this morning after a brief illness. He was 70. Afsar Jafri was associated with Urdu unit of News Services Division of All India Radio for about 40 years. In Ladakh, the governing body of Yuntan Society, the Single Implementing Society (SIS), has approved a 167.25 crore rupees plan for Samagra Shiksha in the Union Territory. More from our correspondent.
UT Advisor Umang Narula chaired meeting of governing body of Yontan Society for Samagra Shiksha in Ladakh on Tuesday. The 167.25 crore rupee annual plan was submitted to Project Approval Board of Ministry of Education for consideration. Setting up of 6 new 100-bedded hostels, strengthening of existing school infrastructure, quality interventions, tablets for teachers, setting up of ICT labs, textbooks and uniforms for students are major components in the next year plan for Ladakh. It is also proposed to vocationalize the education in 13 schools, strengthen the vocational education infrastructure in 29 existing schools and strengthening of diet and sports infrastructure in the schools. Ramesh Chandra, All India Radio News, Leh.
Bangladesh has conducted the first test run for metro train in Dhaka. The test run for the first electrical metro train in Bangladesh was conducted on Tuesday in Dhaka. Road Transport and Bridges Minister Ubaidul Qadir inaugurated the metro rail test run virtually. 6 coaches of the metro train imported from Japan left the workshop inside the metro rail workshop in Diabari in Dhaka to travel about 500 meters at a slow speed. Speaking on the occasion, Minister Ubaidul Qadir said that metro rail is no more a dream, it is a reality now. Japanese ambassador to Bangladesh Naoki Ito was also present on the occasion at the test site. He said in a tweet that the first metro and electrified train in Bangladesh will be a symbol of the changing face of Dhaka. After the receiving inspection, the trains will go through a functional test followed by a performance test in August. However, the start of the metro services in Dhaka may take another 6 months to a year to complete all the required tests and trail runs. Bangladesh is building a 21-kilometer-long mass rapid transit system from the capital's Uttara to Moti Jheel at a cost of 22,000 crore taka. The metro line, MRT6, will have 16 stations. It will substantially reduce the travel time between the 2 points. Indian scientists have made a major breakthrough in the field of cancer diagnosis. Mumbai-based Epigeneres Biotech Private Limited and its sister concern Singapore-based Zar Labs have devised a non-invasive test which will be able to accurately prognose presence of cancer in the body even before a year the tumor cells are formed and related symptoms are visible. This technique, which is known as HRC test, will help in early diagnosis and treatment of cancer. The HRC test will also save the cancer patients from the burden of huge financial implications involved in treatment of tumor cells at a later stage. Speaking exclusively to AIR News, Promoter Director of Epigeneres Biotech Private Limited, Mr. Ashish Tripathi said the special point of the diagnosis is that it can be conducted by a simple blood test. Mr. Tripathi also informed that HRC test is a novel, non-invasive blood test that can detect all types of cancers, including solid tumors, hematological malignancies, and sarcomas. He said this study was published in April issue of STRR Stem Cell Reviews and Reports.
And now let's take a look at the weather report and forecast for today. National capital Delhi is having a generally cloudy sky with light rain. Maximum temperature will be around 39 degrees Celsius. Minimum was 24 degrees. Mumbai with partly cloudy sky will see a maximum temperature of around 34 degrees Celsius, rising from a lower level of 27 degrees. Kolkata is having rain or thunder showers with strong gusty winds. The city temperature will move from a minimum of 25 degrees Celsius to a maximum of around 35 degrees. Chennai is witnessing thunderstorm with rain. Maximum temperature will be 36 degrees Celsius, while minimum was 25 degrees. Srinagar is facing generally cloudy sky with moderate rain. Temperatures will hover between 13 and 20 degrees Celsius. Jammu is having a partly cloudy sky with possibility of rain or thunderstorm or dust storm. Temperatures will rise from a minimum of 22 degrees Celsius to a maximum of around 34 degrees. Leh is having a generally cloudy sky. Maximum temperature will be around 18, rising from the minimum of 5 degrees Celsius. Gilgit is having a generally cloudy sky with 1 or 2 spells of rain or thunder showers. Temperature will move from a minimum of 13 degrees Celsius to a maximum of 29 degrees Celsius. In Muzaffarabad, the sky is mostly cloudy. Temperature will increase from a minimum of 12 degrees Celsius to a maximum of around 22 degrees. Dehradun is experiencing thunderstorm with rain. Maximum temperature will be around 32 degrees, rising from minimum 19 degrees Celsius. In Chandigarh, sky is generally cloudy with 1 or 2 spells of rain or thunder showers. Temperature is likely to rise up to 31 degrees Celsius from 24 degrees. In Hyderabad, rain or thunder showers would occur towards the evening or night. Temperatures will fluctuate between 24 and 38 degrees Celsius. Ahmedabad is having a clear sky today. And now, before we end the bulletin, the headlines once again. India registering declining trends in the number of active COVID cases. Recovery rate improves to 83.04%. Over 17 crore 52 lakh doses of COVID vaccine administered in the country so far. Country registers over 3 lakh 48,000 new COVID cases in the last 24 hours. Government ramps up availability of amphotericin B to fight post-COVID complication of mucormycosis. Ministry of Power takes measures to ensure uninterrupted power supply to 73 major identified oxygen plants across the country. Tamil Nadu announces compensation of 25 lakh rupees each to 45 families of doctors who lost their lives in frontline duty during the pandemic. Assam issues new COVID-19 SOPs for urban and peri-urban areas. Bihar allocates 1,000 crore rupees for free vaccination of 18 to 44 age group. State to recruit 2,580 doctors in rural areas to contain pandemic. Bangladesh conducts first test run for metro train in Dhaka. On International Nurses Day, Prime Minister Narendra Modi expresses gratitude to the hard-working nursing staff who is at the forefront in fighting COVID-19. And with that, we end the midday news.